Good morning, everyone. Welcome to this class. Today is our first class of medical sociology. I'm Dr. Martin Department, Assistant Professor, Sociology Program, MTSU University. So I welcome you all in today's class. Today we'll be thinking about medical sociology, Block-1. That's what we cover today. I hope you all are fine. Let's begin our class. So this is your fourth paper of this semester, SOM 6214, Medical Sociology. This course, mostly Block-1 is about, it introduces social perspective on health. What type of, how those sociology look to health, that's what we need to study in this course. So the focus is on health, illness, healthcare system, and society. How the society and health is related. That's what we can study. So Block-1, what are the units that we have? Number one is we have medical sociology, where we study about what does it mean by medical sociology, and we also study about community health. Community-wise, what is it called, and how the nexus, the relationship between health and society is to also study. And we also study how disease and how society are related, how the society, how we stay, how it leads to disease. And the last one is how sociological perspective, in a sociological way, what is the ethical issue, what does our view on medicine or healthcare, that's what we study is Block-1. So in simple term, medical sociology studies about health and illness and how it is influenced by our society. So it examines the relationship between healthcare and society. Healthcare is what? The medical system that we have, the healthcare system that we have in your country or in our state. That how does it is influenced or it is affected by society. So our health is also the kind of inequalities are there. So some are in some places people don't get much disease, in some places they get more disease. So what can be the reason behind? So what are the equalities? Some are poor, some are rich. So how these affect our health? That's what. So what are the scope of medical sociology? Medical sociology, what are its scope? We'll be able to know what are the social, what are the factors which affect our health. So we'll be able to know that healthcare system institution, we'll be able to know the healthcare system within the country, how this institution affect our health. And in a medical system, a very important aspect of this healthcare system is the relationship that we have between a doctor and a patient. What are the relations they have? Is it a cordial relationship? Is it the doctor are only they want only the money from the patient? Is it their goal? Is it their motive? Or is the doctor really want to have the patient? So this is what we study in this relationship. And the last one is medicalization and health policy. How simple health, not it may not be health issue, but nowadays it has been converted to health. That's what medicalization comes about. So this area of medical sociology. So there are few areas where areas means where we focus on. Medical focus on these things. So number one is health and society. The society that we live in, how it affect our health? How are these two related? So this one main focus on this medical sociology. The second one is health care system. Healthcare system, what does it mean? It means the medical infrastructure that we have in our locality, in our state. The third one is health inequality. What does it mean? It means that why there is the disease that people have is very different from person to from place to place, community to community. What can be the reason behind? According to class, the disease also changes. So what are the reasons? So the objective is the major objective is the major objective of medical sociology is understanding the social determinant of health. Uh, study health inequalities. So these are the one number second objective. examine social network and healthcare, analyze healthcare policies. So these are the four objectives of medical sociology. We also have other uh, objectives. We also explore in futures slide and subjects. So the principle of medical sociology is sociology tells that this health and illness are comes from the society. It's we who define this illness, this is not illness. Who define it? The society define. So this comes from the society. So healthcare system, if there is an so social determinant influence health outcome. Social determinant means our income, our caste, our environment where we come in. So these are all comes under social determinant which influence on health. So the last one is healthcare system save patient. What does it mean? It means that the healthcare system that you have, suppose we are in a private hospital, what is the expense that we will have if we have the money? We'll go there, our case will be done easily, and plus we'll take the money, but the time does not take much. And they'll give us a 5-star treatment in their the room that we stay. It will be quite funny. They'll be making us involved in basic necessities for a patient which is needed. But in government hospital, you may not get that patient that good experience that we expect from a healthcare system. So, what are the things? How will it affect our health? This healthcare system. That's what is the principle of this. So, talking about health equality. What is health equality? Uh, when we, when you say health equality means how because of no they that's because someone doesn't have money, someone is not that rich enough, is not able to afford the medical care facility that he needs. Then because of that, they have more diseases. They're not able to treat them in the beginning itself. So because of that, they are not able to access good healthcare. Because of that, their health is affected. So this is what inequality. Uh, very limited healthcare access that they have because they are very poor. They're not able to pay the hefty fees that they have to pay to the hospitals. As we see in rural areas, there are not good facilities of health. Whereas if you come to urban, you might have we have a good healthcare facilities compared to rural areas. So there are differences between healthcare system and access according to place where we according to the money that we have. So medical sociology connects sociology with healthcare. So is the branch of is one of medical sociology is one of the branches of sociology which connect which studies healthcare, how these two are influencing each other and explain. So social factor influencing health. Our money is affected by our health is affected by the money that we have. The things that we eat also affect our health. If I am poor, I may not be able to have good vitamin or good food that I need. If someone is rich, will not be staying in crowded place. But if I'm poor, I'll be staying in a crowded place which can invite more diseases. So these are the few things which affect our health. The society affect our health. Health is not a personal issue. It's also where you are surrounding with the society where you are living that affect your health. That's what the legal society talks about. So unit 3 is about health, community health. So community health is about how in a large scale a group of people, how is their health affected? Focus on health of population, not only individual, where our focus is not only individual health. If we want to have a good healthcare system, and if we want a good population where there is no much health problem, then we should have some health policies, health program, which will reach out to all the people and which will make our citizens in a better health condition. So studies environmental and social factors affecting health. Environmental also it affect our health. Suppose if there's a factory, big factory, maybe a chemical factory in our locality, it will affect our health and social factors. Maybe if there is too much of disturbances in area, too much of insurgency, which is a social issue, but it will affect you mentally and it will drain your energy. So it affect our health one way or the other. Determinant of what our health is determined by what is influenced by what. First of all is biological factors. Our gene that we get from our forefathers that plays an important role on in futures whatever uh, disease we have. If our forefather had, our father had, our grandfather, that type of disease can come to us too. And the other one is our lifestyle. What type of lifestyle do I live? Do I live a stay, moving lifestyle where I move here and there every day? Or if I have a stagnant lifestyle where I just come to office, just stay there for the whole day, sitting in chair. So do I have that type of lifestyle? If you have that type of lifestyle, you have different type of disease. If you stay only one place, one room, and if you sit in only one place, your occupation also will have effect on your health. Your sitting posture, the chair that you sit, uh, it can affect our lifestyle, what we eat, how we dress. That can affect and socioeconomic condition. Socioeconomic condition means the money that you have that can be affecting us. Because if we don't have money, we're not able to have good healthcare facilities. The other one is healthcare access. Is it near to us? Sometimes if I'm staying in rural areas, I may not have that better access like how I stay in urban areas. We do watch short videos on what is health sociology and medical sociology. we'll proceed. This video has little issue. Maybe it is not audible to you. In future, I'll try to make a video where it's audible. Uh, okay, now let's talk about determinant of health model. So social factor, what does it mean? And environment, what does it mean? And what is healthcare system? So these three things, we'll try to know what are these. First, social factor means from which uh, area I'm from which economic background I come from. So all this comes under one. From which educational status do I come from? So those are your social factors. Environment, maybe the place that I stay, is it crowded? Is it a mountainous area? Is it a forest area? So those are our environment. The health system, am I staying in urban areas and do I have access to better healthcare, or do I stay in urban areas where there is not, do I stay in rural areas where there is not much healthcare? If I stay in rural areas, I will not get access. If I stay in urban areas, I might get access to better healthcare facilities. Now, level of prevention. To prevent a disease, what are different type of levels that we have? Number one is primary prevention. Diseases. Second, prevention is early detection. So the primary prevention is before the disease comes to us. We'll try to make our lives in such a way that it does not affect. We don't go to that level where the disease comes to us. So that way, that means we prevent before it comes to us. And the second prevention, that is early detection. What does it mean? That means even if we have a disease, if it is treated early, it can be stopped from having a bigger problem or bigger issue if it is detected in the earliest stage of life of the disease. So uh, it is one of the most important factors. This plays an important role on how the persons live for long or their life is short, because early detection plays an important role. Suppose it's already not detected now. What is the third one? Third prevention, rehabilitation. That means we have to live our life in such a way that it does not go this and beyond. Rehabilitation, when you have rehabilitation camp, rehabilitation, we have in our also, if you see, we have many rehabilitation drug addict. So those type of things are kept there. So that we can manage them, and so that we will try so that it can be they can be brought to the society again and live a proper human life. So example of public health. So what does it mean, the public health? And it's where the government plays an important role in making public health, and then is community health. Vaccination program. I think if you all know, vaccination program means we have COVID-19. If you remember, COVID-19 was there in, in this world, which we all have experienced. So because of that, we all get vaccinated. Then we are not much affected by that virus. And after that, uh, we have the second round of vaccination again. So this level, it makes us more stronger to counter these viruses. And we also have in India polio vaccination, where uh, small children are given that vaccine in their polio drop, so that in future their health is not affected. So this type of vaccination program is not a single individual is the focus here. It's community health. It's for everyone. And the other one is health education campaign. What does it mean? Health education campaign. These are the prevention, how to prevent major health disease in a society. So number one is through what? Vaccination program. Number second is through health education campaign. It means when a group of knowledgeable person about health and hygiene, doctors, maybe other from healthcare officials can go to a public place, in a market or in an education institute, in a school, in a college, in universities. They go there and promote that healthy lifestyle. How do we live? What are the vitamins that we need to eat? and what is the lifestyle that we should live so that we are not affected by disease. Most of the time, they will tell us drink a lot of water, apple a day, keeps the medicine, the doctors away. So this type of campaign is very effective in making the public understand that uh, our health is influenced by how we live our life, what we live, with whom, where do we stay, what are the things that we do in our life, and screen for diseases. So even there is no diseases, we should always do health checkup so that we'll know that what are the diseases that is there in our body, so it can be detected early. So that screening of health. Another focus of another focus is M3. That is, public health focuses on improving population health, which is policies, education, prevention. Policies plays an important role. Our government main motive is how do I make my health, my citizen more healthier, and so that our country is more we will able to progress only when we have a good working population, when we have good young people who can contribute to our economy. And for that, the government makes so many policies so that our health is in the right shape. These are some of the examples of our health mission that we have. So, National Health Mission, health, public health in India, this is the main focus. The National Health Mission, I think you all heard about this. About this. This is a mission which promote, which work to prevent so many diseases and work for the betterment of the community. As soon as so the other, as what I had told you before, COVID-19 vaccination program. So this type of thing that is done, it is done by the government to make the public in a healthier society, so healthier citizen. Disease pattern influenced by social condition. Now, what does it mean by disease pattern? Social economic effect, inequality effect, disease spread. So disease pattern influenced by social condition. Suppose I am a very rich person. So a rich person, mostly they might get, whatever disease look at most, you have diabetes. But a poor person might get malaria, tuberculosis. So why maybe some other diseases which is related mostly because poor people, uh, some viral fever, malaria they can get because the poor people may not stay in that hygienic place. They will be staying in a crowded place, so it can affect uh, their health when it's too crowded. But a person who is too rich, there then they might get heart attack because they do more mental work. So because they might get more. I mean, they're eating heavy. Maybe they eat too much sugar. So diabetes it can be. So the disease differ, and they might not work like how poor people work. The rich people just get stay in AC and stay in comfortable lifestyle. But so this what the disease also is different. The rich people disease is different. The poor people disease is different. And the other one is socioeconomic inequality affect disease spread. So when rich people during this COVID times, who is more affected? The poor people are more affected. Why? Because they stay in more crowded places. These people they might have their bungalow, they might have their flat, but they could stay in slum areas where there are very so many houses together attached to each other. So because of that, disease spread more faster. So COVID is spread more. So because of that, they are more affected by COVID-19. This what it says by economic knowledge affect disease spread. So, as I told, what social determinant of disease? What are the factors which affect our disease? Number one is income and poverty. How rich we are, how poor we are. Do we have the access to healthcare? Number one. Number second, education level. How is education plays important role in disease? Because when a person is not much educated, we're not able to know what the hygiene that we need to maintain so that we don't get dead disease. But when a person is educated, he is well versed with our body, he knows which medicine to eat or which fruit to eat, so these diseases does not come to me. So when the education level is higher, we have better understanding of disease and we try to avoid. The other third one is housing condition, where some house may be too congested, then they place disease can spread. And the other one is healthcare access. I have told you before, uh, maybe in rural areas, they might not have better access to healthcare or hospital facilities compared to the urban areas. So these are all related. Society, environment, and health outcomes. The society will be where with whom I live, or what are the things that I eat, maybe, or in which condition do I live in. Environment, then, is it a cold place? Is it a crowded place? Is it a place where it's very warm? So this influence of society, environment, it will have an effect on our health. So these two plays an important role. What type of health we will have? Society and environment plays an important role. So this is what one of the example of COVID-19 I have given before. COVID affect poorer people more, limited access, increase access, increase mortality, limited healthcare access. So because of limited healthcare facilities, the number of deaths are more. So what is medicalization? Medicalization means where in today's time, everything, anything you have, that I go to doctor. So even I have little, I'm sad. I mean, sadness, joyness, maybe joyfulness, maybe someone might have anger. I may be angry. There's an emotion, but everything has been turned as disease. Anger has been turned to a emotion has been turned to a disease. A simple sadness may have been turned to a depression. So these type of things, which is a normal social issue, social health issue has been turned into a disease. Suppose aging, childbirth. The childbirth nowadays has become a medical issue. Before childbirth is done by some midwives in home itself, they, they do childbirth through the help of midwives. But nowadays, we have to go to doctor, hospital. So this has changed a lot. In our home itself, before due to by the help of midwife, people can give birth to their children in their home. But nowadays, not possible. People go to doctor. So those simple social issue or social factors have been turned to a medical factor. Aging issue. Aging, is it a disease? Is it not a disease? It's a part of a human growth. Now, what is people are using anti-aging. So those type of plastic surgery people use. So this simple social issue has been turned into a normal issue has been turned to a medical issue. Aging is a proper process of human body where a person goes from 1 year to 80, 90 years. So it's normal, but people has turned this age into a disease. They have invented a new technology, anti-aging, some cream or some medicine they may have invented. So this simple issue of social issue has been turned to a uh, medical issue. If someone is sad, sadness is also part of emotion, but it has been turned to a depression. Of course, depression is important, but it's simple sadness. People have done everything in it. pure depression is in depression. So emotion has been branded as disease. So over medicalization. Now this will depend too much on what the because of this simple issue, social issue has been turned to a medical issue. So people are doing too much of dependence on medicine, pharmaceutical influence. Many companies are there. They influence many doctors, many hospitals that only this medicine you give, so that there is no profit. So there is any healthcare inequality is there because of the income differences that we have in our country. So example of health is a mental health stigma. It has become a big problem in today's society. Everyone is in depression. Simple sadness also everyone has branded this into a depression issue. Of course, when a person gives too much of depression is a even simple sadness has been turned to a depression. Not I'm not telling that there is no disease as depression is there, but simple sadness, emotion has been turned to a big issue of behavioral issue. Simple behavioral issue has been turned to a disease, and for that everything we have to depend upon the doctors and the medical infrastructure. So, what are the questions that we have come across in today's class? We do discuss this in our future classes. So, what is medical sociology that I told you in the first video? So, example, social determinant of health. What are the factors which affect our health, and what's the importance of community health? What are the things which plays an important role in making a community a better citizen, where there is a good health care for all the citizens. Difference between healthcare and medical care. So this is what the question that we discuss in next class. And these are the second block. We'll do this in our next class, unit 6, which is on illness and dysfunction. This is our unit 6 and numbers. Unit 7, there is functional approach to sick role. So we'll discuss on this topic in our next class. And the other topic is unit 8, criticism sick role. We'll do a criticism of what is sick role. We have to understand this. And number 9 is labor injury. There's a theory on this. So we'll discuss this theory in detail in our next class. And lastly, there is unit 10, illness and social deviance. So these 5 units will be covering in our next class. So thank you all. If anyone has any question, you can ask. And we'll be doing the next class. This all 6, 7, 8, 9, 10. Then we will be covering in the next class. After all, nice weekend. We'll meet you on the next class. Thank you all.